Good morning, Jackie.
Good morning.
How are you?
Just a little cold, but I'm doing okay.
Well, sorry to hear that, but I'm glad you're here this morning.
Yes, I'm glad I'm here.
All righty. Who's your project host, your guest this morning?
That's Dr. Robbie Johnson.
Good morning, Dr. Johnson. Thank you for being with us this morning.
Good morning. I hope you're doing well.
We're fine. Thank you. We also have Dr. Jeff Hamilton with us this morning. Dr. Hamilton is the program coordinator for the DEOL doctoral program at Gardner Webb. Welcome, Dr. Hamilton.
Thank you. Good morning, everybody.
Good morning.
Jackie, are we expecting anybody else that we need to have before we start?
We can start. I think she may come in, Kim Morrison and Tony Woods and Sheila Palmer, but we'll continue to go on.
Okay, you go right ahead and share your screen and get started this morning.
Okay.
Thank you.
Let me go back to. Okay, can everybody see my screen? Can
No, we
everybody see
can't.
that?
No.
You can?
No.
Okay.
There you go.
Okay.
You started, and so there it comes. There we go.
Okay. Well, good morning, everyone. My name is Jackie Palmer, and my project centered around building health and safety initiatives in faith-based organizations. And so when you think about health and wellness, it goes back to biblical times in which the church has always responded to the needs of the congregation, whether it be to the sick, those that are dying, or just feeding the hungry and the poor. And so health and religion always, they go back. When you think about health and religion, it's meaning coming to the church or believing that health, either by prayer of faith or by laying of the hands. And in James 5:14, it says, if there are any sick among you, call upon the elders of the church and let them pray over you in the name of the Father. And so therefore, that health and biblical times, or health and the religion, goes back. We also think about health and religion. We know that in order to have, we need healthy congregants in order to fulfill the mission of the church. And when your congregation is not healthy, you cannot fulfill the mission of the church. And part of that mission is to go out, therefore, in all the world and teach them. And when you don't have healthy congregation, then the work of the church is stifled. When you think of, and that goes back to your Matthews 28 and 19, a faith-based organization has always been the weekly place for which congregation comes in to get that refuel for the week. And also is a place to have a place in which you get your spiritual renewal And it's also a place to learn kingdom principles. And those kingdom principles allow you to live out your life, especially in handling crisis, whether it be crisis at work, whether it be health, whether it be related to what's going on in the society. And so therefore, now you're able to handle some of those issues that may come against you and that bring a disappointment. And also too, when you think about those challenges in life, where we're looking about that well-being, the church has always been a place where you can come and get that support, and making sure that that well-being is that encompassing your emotional health, your physical health, your spiritual health, your social health, and in your financial health. And the church has responded to those needs by having support groups such as divorce recovery, having support groups such as the cancer care ministry, support groups that deal with the finances, and also the support groups that are dealing with bereavement. Looking at the healthcare ministry as part of the background, they also help to bridge those pieces of that wellness together and focusing on that physical piece in order to promote healthy lifestyle behaviors. There is one large hospital system in the Charlotte area, and part of their outreach ministry is to provide those health and wellness resources to the community, because they realize that the church is a strong organization in which they influence the way that congregates actually live. And also too, the health department in the Mecklenburg County also realized that. So they do connect with the churches in order to provide those health education resources, mainly through what we call the Village Heartbeat. Who is better able to bridge that health and wellness together is the faith-based organization. But we have to look, do they have the capacity in order to promote that health and wellness entity, and do they have those safety programs? So the purpose of my project was actually centered on health, education activities, and also when you're dealing with those health and activities. And the initial goal was actually looking at one particular church. And therefore that church actually, because of the COVID and other entities, that church had to forego their promises. So therefore I was looking more at another church. And so we also look at those safety measures. Do those churches have the ability to provide those safety measures to keep that church safe? And how do they respond to medical emergencies in the church? Do they have the safety in which if there is a active shooter, do they have those training? If there is a crisis, when you're thinking about natural, whether it be a tornado, whether it be hurricane, do they have those safety measures? We know from past that there have been shootings in churches, whether looking at the Charleston shooting, we're looking at the synagogues in New York, Texas, New Zealand. And so we have to making sure that our congregation is safe. And also, do they have those safety measures, and the fact that how can they rebuild themselves if they're facing natural disasters? How do they get back when they have those natural disasters? When you're thinking about Hurricane Katrina, you think about Hurricane Floyd, Hurricane Maria. Because those congregations, those churches are in the community, we also have to look at how are they going to rebuild themselves. So the adaptive goal was not looking at one particular church, but actually looking at several other churches. And that churches was of varying sizes in North Carolina, as well as in South Carolina, some within the Charlotte metro area, others were in other counties. So the scope of my project actually looked at the cultural traits of the organization, cultural traits, and looking at the consistency of that organization. Do what they do now coincide to what they actually are doing? You're looking at your involvement. The community is engaged, the adaptability, are the congregation, are they able to make those changes as the congregation needs it. And then the mission is there, the mission of the church. Is that mission of the church in line and where the church wants to go? We know that in order, when we have a congregation that actually that high performing, that you know that you have more volunteers, that church is willing to grow, they're encouraged to learn, and then you have more participation. And looking at the capacity, does that church have the capacity, or the faith-based organization have that capacity? The capacity meaning, do they have the volunteers? Do they have the space? Do they have the technology? Do they have those leaders that are willing for that church to grow? So the goal actually was to promote those healthy lifestyle and empower those congregations to provide those activities. Part of that feedback that I was looking for is to develop an action plan for health initiative. And that action plan was not included, but not limited to providing wellness education, providing blood pressure checks, providing blood sugar checks, providing weight loss, weigh-in, as well as providing some information on CPR. It also can include health fair, providing a health fair, and what that evacuation plan looks like. Again, if you do have an emergency, or are they practicing that evacuation plan? And also establishing some protocols. So if there is a medical emergency within that church, how they're responding to that medical emergency where there's less disruption, but also making sure that whoever's involved is safe, and also you keeping that church safe from any other, any type of litigation. And also, what does that safety look like when you have an active shooter plan and safety measure crisis? Do you have a plan? Do you have a plan where if something happens, who are going to be your key people? Who are going to be those people that you're going to respond to, or those people that if anything happens, are those people who are going to give out the information that is correct, that is timely, but also looking at a crisis management plan. Again, the overall goal was to not only improve, provide information that improve patients, or congregants' lifestyle, but also to maintain and continue to bridge that health and that safety approach. The approach that I took was a quantitative approach using the Denizen Culture Survey, which was a 48 question questionnaire on a 4-point Likert scale. And again, it covers the involvement, the consistency, the adaptability, and the mission. Also, too, I looked at the faith-based organization capacity inventory survey, and that was a 21 question survey with open-ended. Again, that looked at, does the church have the technology? Does the church have the technology support? Does that organization have the space? And do they have the volunteers? And also, do they have those people that are willing to support? There was an 85% completion rate in those surveys. And so when I look at my data outcomes from there, when I was looking at the entities involving the involvement, the adaptability, the mission, and you're looking at your the entities for the Denizen surveys, the lowest scores actually looked at the mission, which was the lowest scores happened to be around 1.3 to 1.5. And it involved the mission, not sure where the mission was going, was everybody sure what that mission looked like? So those scores tend to be a little lower. Your highest scores actually centered around the consistency. They were consistent in what they do. They were adapted to the change for whatever that comes their way, especially now that COVID, they have to adapt. And so those scores were the highest scores were between 2.3 and 3.5. And they centered around that everybody was in a collaboration. There was a empowerment for congregation to be involved, and they promote that involvement and created a space for creativity. When I look at the faith-based organization capacitory inventory survey, again, that was the 21 question, and that did have some open-ended questions. And the faith-based organization responded at least that they had at least 2 activities per year. They did have their technological support. They did have collaboration between one ministry or another ministry. They had collaboration within the community and community organization and with other churches. But in those listing of the activities that they actually provided, they did not list any safety measures on these activities. So we're looking at my literature review. Again, when you think about health and religion, it goes back to biblical times. When you think about the ministry of Jesus, before he did anything with the soul, he actually responded to those needs. And those needs, whether it be feeding the hungry, which he fed the 5,000, or he was healing, whether it be healing of the paralytic man. And within the Bible, there are many, many instances of Jesus's healing. As you move into maybe the 1800th century, you have Elizabeth Fry, who was instrumental in bringing more of the health into the prison system. Not only just prisoners being in prison, but making sure they have a healthy place in which they have to serve out their time. We're also looking into Calvin, in which his ministry looked at outreach ministry within the community. And we have Oberlin back into the 1800s, and his ministry actually focused on bringing more health into the agricultural sector. And so that encompassed that diaconal ministry. And even today in many of our churches, we have that diaconate. Some consider that as the deacon, the deaconess ministry that serve the sick and serves the poor. Some now consider that as the Stevens ministry in some churches, which is that out arm of the pastor. And when you are going to see the sick, you are going to making sure that the needs of the church and the community are being met. And now you come in the past couple of centuries, the parish nurse ministry. And that is the ministry that bridges that health and wellness together, those entities, particularly looking at the physical health and making sure that they're providing those services, making sure that the congregants can come in and do a blood pressure, get their blood pressure checked, get their blood sugar checked, get their weights checked, and also any other information. And give just some information, how can they go about when they do go to their physician's office. Now, in some churches, in some clusters of churches, parish nurses are part of the staff. They are paid by the church, and they also are paid by some of the healthcare institutions in the community. When we think of our health statistics, we know African Americans do have a higher instances when you think about white Americans. When you think about health disease, they have a 61% higher. When you think about diabetes, there's a 23%. And when you think about stroke, there's a 7%. So you see that with those statistics, there definitely is room for health education. Many church studies, particularly there was a 300 church studies of African American churches that reveal that they want more information on salt intake. They want information on weight management, and they do want more information on what they need to do as far as to become healthy. Another study says that they want those information where they can actually see what does that disease process look like. They do want those assessments that can help them and give them a little more advantage when they do approach their physicians. Part of that literature review is looking at Maslow hierarchy, which is that social need in which we all humans need in order to survive. And I'm going to go a little bit in that Maslow, and looking at that, he has his hierarchy needs of the physical safety, loving, belonging, and self-actualization. But in order for anyone to move up that chain, we actually have to look at that physical need first, and we actually have to have safety. And when you do not have that, there is no way that you are, most congregants are not going to be considered about medications and going to the doctor when they do not have food, they do not have shelter. And the same thing with safety, if they don't have a place to live. And in times if you have homeless, you thinking they're not going to go to the doctor, they're not going to be caught up on their medications. So you need that. And before I go back into the risk and constraints, and you're thinking of that Maslow hierarchy, you have to think about the Lord's Prayer. And it encompasses that hierarchy when you think about the bottom. It says that, give us this day our daily bread. You thinking about that. You thinking about that safety, lead us not into temptation or deliver us from evil. And those words that says our and thy kingdom, that's part of the belonging. That's part of making sure that you're part of that entity. And when you're looking at, again, that Lord's Prayer, it encompasses that whole Maslow hierarchy of that need in which we all need. Looking at our risks and the constraints that I had, it was that participation. Would I have enough participants? Will volunteers be willing to do 2 surveys, especially when you're looking at the survey that had the 48 questions? Will they complete one survey and not complete the others? There was very little of that. And would they be receptive to those results, especially those results when you're thinking about mission? And also, are they receptive to their recommendations from those results? The constraints are looking at the church budget. Will the church be able to provide some of those activities more than what they're providing? And because of COVID restrictions, churches were not meeting for a while. Some churches are back to half. And so therefore, sometimes when people are not working, they're not able to contribute to the church. So therefore, budgets may suffer. And also you're not able to bring the congregation together as a whole. An action plan looking at the strategic plans for church re-engagement and health and safety initiative. And that re-engagement actually is looking at that mission, focusing on the mission. And part of that re-engagement, what is the direction of the church? Looking at possibly a timeline for 18 to 24 months, because now we're still in COVID, that timeline will probably increase. But when you think about mission, you want to focus really on those leaders of the church, ensuring that first of all, the leaders are in one accord. And sometimes you may have to look at refocusing. You're refocusing on the leadership, making sure that everybody's online by doing a Bible study. And then you actually tailor that Bible study to all of the congregation. Also refocusing and looking at the mission. Do your mission continues to align with where the church is going? Is that mission easy to understand? Is that mission simple? And making sure that every activity that you're doing is in line with the goal of that mission. And so sometimes you may have to revisit that mission, or you now have a theme from the church, maybe the same theme from one year to another, or each year if you have reach that goal, you may have to retailer that goal or that theme for your church. And the reason why I have that mission, again, if you do not have high performing organization, then you're not going to have that engagement and you're not going to have the empowering the people. So that's why that mission is very important. And the other part of that quality assurance plan is looking at that health and safety initiative and developing a short-term and a long-term plan between 24 to 48 months. And most of the churches do have a health activities, but why not just go in and involve the healthcare ministry, volunteers, involve the security, involving the trustees. And the reason why those people are important, because the trustee, and for most churches, also helps with the budget. And you're looking at your security director and making sure that the church is safe and bringing everybody in one accord. When you think about looking at health and safety, do a congregation health needs assessment And that will tell you what are those activities that is most important to those churches, and also telling you those activities around that. And when you do that, you're able to pull from some resources, and some of those resources, looking at the health.gov, and which is a calendar of actually what health needs for month to month, and what those health initiatives or those health awareness they are actually tailoring to. And with those, they do provide those resources. And also you're collaborating with some of those health agencies in the community, national, whether it be the American Diabetes Association, the American Heart Association, the American Stroke, the National Stroke Association, excuse me. And they have those information that either can be downloaded or that can be provided as a handout in order to address those health needs. And when you do have those health needs, now you're not only tailoring to just one group, you're actually tailoring to your youth, you're tailoring to your young adult, and you're tailoring to your older adults, because they're going to need different things, but yet you want to try to make sure you reach everybody, because again, you need that healthy congregation in order to do the work. And when you're thinking about those safety, looking at the director of safety, making sure that there is a safety plan. If there is a fire, how do everybody gets out? What is the plan? Making sure that you know where everybody's going, where everybody's going to meet up. Again, looking at that medical emergency, how they're going to be handling that medical emergency in order to decrease the disruption in the church. How are they going to bring those services and needs? And how are you going to handle that need if there is something that happens in the church? And part of that is to the indicator for success that you have a plan in place that is not only a written plan, but also a plan that you, if you need to start developing a plan. And part of my deliverables was creating a brochure that actually had some of those things that churches can consider, a faith-based organization can consider in order to respond to a medical emergency. So they have that toolkit, and also some information in how to respond to a crisis in the church, as well as your crisis management plan. Who do you call? What are your documents? Where your documents are located? And also collaborating with probably a PR representative to kind of give you a little bit more guidance in how are you going to respond and how you're going to need to respond. My reflection, looking at I had to adapt to the direction of the project, being that COVID happened and the church was no longer able to support in that commitment, then I had to adapt. Reflection was visiting some more of the churches that I did not have a good idea of their layout. Would have been able to do that, again, because of the restrictions, I was not able to do so. And add a little bit more questions on that safety measures when I look at that faith-based capacity inventory survey to maybe trigger some more activities that they're actually doing that pertains to safety. As I mentioned, I did do a healthcare brochure that will bring about some safety measures and how they can handle medical emergencies. And also continue to follow up on not only on after I have completed, but just to follow up on what it looks like as far as the churches goes and any implementation that they have possibly have done. The area of future studies are looking at health literacy and providing those information and those health activity, making sure that those information are on the readable level for some congregants. Sometimes we're dealing with a church that have young adults, and also you may dealing with a church where basically you have older adults. So you want to make sure that the information that you're bringing are understandable. And looking at support groups in the faith-based organization, not only having one church do it all, but also a group can collaborate within a ministry, providing those support groups like divorce recovery, providing those support groups like cancer care ministry, a bereavement group, and any other groups that are weight loss or a challenge. again, the ongoing and other future studies to continue with the ongoing support, providing that support and what things that they will need, some things that they need to look at as the makeup of their congregation. Here are my references. And are there any questions?
At this time, we'll open up the floor for anybody that has any questions. Excellent presentation, Jackie. If you will stop your screen share, I'll go to our document and we'll work through our list of things this morning. I think I went down through and checked all things as we went through. And so I think you answered all the things in the first 9, which are the standard questions. And so we're down to which of the courses that you had during the DEOL sequence impacted you the most and why?
The course that dealt with organization, the makeup of the organization, and also the course that for the self-assessment. And one of those is, as a leader, you have to do self-assessment. And one of the things that I really picked out is the Johari's window. And I have that hung up because it allows me to know who I am, but also to me. And during this course, I found out there are some things that have been blind to me that other people knew that I did not know. So it allowed me to be able to put some sticky notes and those things that now that I've known, how can I make a difference? How can I change the way that I think about that? Another course was the book on real leadership. What does real leadership look like? Making sure you make those adaptive changes, but also make those changes for creativity and ensuring that you know who other people are, because a lot of times we think we know, but we don't know. And when we know who we are working with and how they operate, now we can operate together. And now we can, make that collaborative effort and to make some changes. I was able to use that collaborative, adaptive in the midst of chaos, in midst of changing from one floor to another. We had different patients and we had to come together because there was a little bit of chaos of who was doing what. And so I asked for a meeting. And so let me tell you what I'm going to do. What are going to be my deliverables? Here's what I'm going to bring and what I expect you to bring. So now we can come as collaborative effort and being able to provide more support to our patients where everybody's not leaving work and frustrated because we are not on one accord. So I was able to do that collaborative work and use that adaptive work.
Excellent. I think you've demonstrated throughout your project this morning, your collaboration, your leadership, and the type of leader you are, which is a servant leader, which of course circles back around to the Garden Web mission, Pro Deo et Humanitate, for God and humanity, to be a servant leader. I think you've exemplified that. So excellent presentation this morning. I don't have anything else. I've checked all the things on the list. We will now go to your partnering organization supervisor, Dr. Johnson. Thank you for being with us today. From the perspective of Garden Web, we appreciate you partnering with Jackie during this process. At this time, I have 2 questions for you. The first is how has Jackie impacted your organization?
Jackie actually created a healthcare ministry for us years ago. We were in when we had outgrown the smaller location and moved up we did not have a healthcare ministry. And so Jackie has actually put that ministry together. And so in the new building, we allow specific room and area for that ministry to have the first aid kits and anything that might be needed in that arena.
Excellent. Most excellent. Dr. Johnson, is there any reason why Jackie should not be awarded her doctoral degree from Gardner-Webb University?
And that I can think of. I'm very proud of her accomplishments and her presentation today.
Thank you. Thank you again. We appreciate Gardner-Webb and the DEOL program. We appreciate your partnership with Jackie. I'm sure she's grown greatly through that partnership. Jackie, as you know, to whom much is given, much is required. The program charge is for you to have a mind for learning and a heart for serving, and always be sure you understand that to bless the family, and that simply means to live and serve your obligations to your church family, your Gardner-Webb family, and to your family. That is your charge. Please remember that you will be the only Gardner-Webb that most people will encounter. They expect you to be an authority and an ambassador for the university. That is our expectation as well. And as you know, in discipline inquiry, being a doctor, you're expected to share what you know, not your opinion, to always be grounded in that disciplined inquiry. So if there's nothing else this morning, I'd like to welcome Gardner-Webb's newest minted doctor, Dr. Jackie Palmer. Congratulations. I'll open up the floor if anybody has any well wishes for Jackie at this time before we close with our prayer.
Congratulations, Jackie.
Congratulations, Dr. Jacqueline Palmer. To God, to God for the great things he has done. I'm so inspired. I'm a Gardner-Webb Divinity student, and I'm so inspired. I've seen your process. I've seen your perseverance. I've seen your tenacity. I've seen your heart. And I just give God all the glory. I love you, my sister.
Thank you.
Jackie, let me congratulate you on this accomplishment. It has been a joy to have you in the program. As Dr. Lamb said, you will be a great ambassador for the university and also for the program. And I just want to comment on some of the things you said in your presentation. And one of them is how much growth I have seen in you from those first couple of classes when I had you, that in some respects seems like 100 years ago. In other ways, it seems like it was last week. But I'm so proud of how you've stepped up, worked on yourself. As you know, in the program, we say, leader, you can't lead others until you can lead yourself, and how you have stepped up and done that. And I couldn't be any more prouder of you and your cohort members as you've gone through this process. And so we're so proud of you. Please keep us in your prayers as we'll keep you in ours. All of you that are finishing this semester will get a link to put your contact information into the alumni database. Make sure you do that. That's the only way I can keep up with you and give you an opportunity to come back and speak to our students and attend our things. So we're so proud of you, and you're such a worthy accomplishment. So congratulations. And Dr. Johnson, while I have the microphone, let me say thank you for partnering. Our program is unique in that our students get to make an impact. They don't just work on a document. They don't just take courses. They partner and try to make a change for the world, which is what servant leadership is about. And if we didn't have organizations like yours that gave our students an opportunity to develop and to learn and to practice leadership, then that would take so much away from our program and from the university. So thank you so much for partnering with us.
My pleasure.
Thank you, Dr. Hamilton. At this time, I will we'll close with our prayer for the week. In serving our theme, Pro Deo et Humanitate, for God and humanity, our prayer this week is "Let Me Serve You" by Saint Teresa of Avila. So if you'll pray with me this morning. Govern everything by your wisdom, O Lord, so that my soul may always be serving you in the way that you will and not as I choose. Let me die to myself so that I may serve you. Let me live to you who are life itself. Amen. Jackie, excellent job. It's been a pleasure working with
Thank
you.
Dr.
Please make sure to follow through with Digital Commons. And we will close this morning. So thank all of you in attendance. Everybody have a good day.
Thank you.
Thank you.
God bless you.
Congratulations, Jackie, Dr.
Thank
Palmer.
you.